I'm going to do a little introduction. It is 3:31, so I think we'll get started. I want to welcome and thank everyone for attending our program and our whole series on building community resilience. And today we're really going to focus on empowering action and a model and talking about a framework for the prevention of ACEs through the promotion of equity, resilience, and well-being. I'm Jeannie Darling, Executive Director of Cornell Cooperative Extension in Delaware County, and I'm excited to introduce our presenters today. But before I do that, I also want to have Yulika talk a little bit about our series coming up. So we want to promote that. And then we really want to also at the same time, thank all of our sponsors and all of our team for putting this whole series together. And certainly the Delaware County Rural Healthcare Alliance for funding this program events, which we started in January. Every month actually coming together and learning about building resilient communities. It's been a fantastic experience for us. And we are recording the webinar today. We have an evaluation that Karen is going to put in the chat. We'll have some time at the end of the program presentation for some questions. So Yulika can monitor the chat for us today. And we'll look forward to everybody's participation. So Yulika, do you want to introduce kind of our program series coming up this summer? And then I'll actually introduce our presenters.
Yes, thank you so much. And I just want to also give a really big shout out to both Ginny, you and Karen for hosting the series. It's really been wonderful working with everyone, and it's great to see questions for more training and capacity building in our communities, and we're really excited to see what happens. So of course we can't stop that during the summer. And so during the month of July into August, we will be holding another lunchtime summer series on Zoom as well, where we will be talking about basically creating a framework that is healing centered, and also how we can incorporate protective factors into the work that we all do, or into our relationships that we have in our communities. And so information about that will come very soon with exact time and date. And as I said, that will start in July, and we will hopefully be able to give also continuing education credits through that. So without further ado, I'm going to pass it back to you, Ginny, and thank you so much.
Yeah, thank you, Yulika, for actually being part of our team and promoting this to everyone in Orange County and the Hudson Valley, along with the Catskill region of New York State. So now I'd like to talk a little bit about our presenters and give a warm welcome to Michael Shirley and Dana Powell. I'm going to start with Dana. Dana enjoys developing individuals and organizations into powerful change agents. Isn't that great? As a parent and community engagement coordinator with the Children's Trust of South Carolina, Dana engages learners to apply knowledge to make their world a better place. And she's joined by Michael Shirley, who also works with the Children's Trust of South Carolina as Director of Community and Workforce Development. Michael is working on completing a Master's of Human Resource Development from Clemson University this year, probably almost finishing it up right now, and is focused on bringing out the best in every person. So Dana, I think, has also been a graduate of South Carolina, the University of South Carolina. So we want to welcome both of them and thank them for sharing the model and lessons learned from work in South Carolina. So it's exciting to have both of you from another state tell us what you're doing in South Carolina. Welcome.
Thank you for the warm welcome, and we have a little presentation to share with you today, and just thank you again for inviting us. I know you've been hearing from some experts from across the country. Some of them are friends. I think you started with Rick Griffin and just had a session with Terry Barilla from the Community Resilience Initiative. And so we're very familiar and have worked closely with them on some of our initiatives in the past. And so now you should be seeing the presentation. Can everyone see? Okay, great. So we really have two goals of being here with you today, and I'm gonna work with the first one and Dana's gonna share on the second one, but we wanna share with you about the Empower Action Model, what it is, why we developed it, some of the science behind it. And then Dana and I have both served as coaches on a pilot project where we actually use the model in a few communities across South Carolina. And so she's going to share some of that real world application at the local level. And so before we get started talking about Empower Action Model development, we always like to start with the why. And why do we care about this as professionals, as an organization? And in South Carolina, and I really should have looked up to see what your numbers look like in New York, but I'm assuming there are high rates of cases of child abuse and neglect. And we know that that's not good enough. We know that we can do better, that prevention works, and that's what we believe in at Children's Trust. And we truly believe that every child deserves to live their best life and to meet their full potential. And that means not just making sure that those bad things don't happen, but also building up those good experiences as well. I know that's what you focused on through this training series is how you build that resilience. Also want to share just a little short history of how we arrived at a project like creating a model. And so this work has been going on in Children's Trust for almost 10 years. Next year will be 10 years. I haven't thought about it that way, but in 2013 is when we really first heard about the adverse childhood experiences study and realized that it was something that we should focus on as an organization. And in the following year, we were able to develop a partnership. And so we realized that many organizations across the country were beginning to collect their own adverse childhood experiences data, and that we could do that in partnership with our health department using the behavioral risk factor surveillance survey. I don't know if you've heard of that survey before, but we were able to begin that data collection to really figure out what ACEs look like in South Carolina. We also knew that this was a relatively new field of study and that many people probably didn't know about the term ACEs or adverse childhood experiences. And so we knew it was important to get that message out there. And so we invited Dr. Robert Anda, one of the co-principal investigators of the original study, and Dr. Laura Porter from Walla Walla, Washington, to come in and train our initial cohort of trainers in their ACE interface curriculum. And since then, I was in that initial cohort, and since then, we've trained over 300 people to be trainers in that curriculum, and has really been a big part of our movement in South Carolina and getting the word out there, just raising awareness about this important issue. But as we began to train, people started to say to us, well, this all really makes sense. We get that adversity that you experience in early childhood can have an effect on your adult health and social outcomes. But what we don't get is what we can do. And so that's when we began in our moving forward portion of this journey, thinking about how we can encourage people to take action and to provide some clear steps that people can take after they learn about ACEs, what they can do to help prevent them from happening in the first place, but also promote some of those positive experiences. And so that's sort of where the Empower Action Model was born out of. We were also doing some work that I won't cover in this presentation, but I encourage you to, if you haven't before, look into the Chapin Hall organization at the University of Chicago. Dr. Deborah Darrow, we had a partnership with them and the state of Colorado to form a prevention framework. And so many of the lessons that we learned through that project were applied to this Empower Action model, because at the end of our project with the University of Chicago, you can imagine it was a very academic publication in nature. And so even with that, even though it laid out some clear action steps, we felt the need to take it to the next level and really put it into to translate what they came up with in that framework into a model that actual community members could use. And so a team of people at Children's Trust came together to take a look at some of the existing protective factors frameworks, because there are a lot of them out there. Just to name a few that they took a look at would be the Center for the Study of Social Policy, Strengthening Families and Youth Thrive frameworks. Also took a look at the Administration for Children, Youth and Families Protective Factors. And then the CDC also has some essentials for childhood. And so just taking a look at some of the existing literature and finding that there are a few questions that we had when taking a look at these frameworks. And just when we think about prevention in general, how do we know when we are preventing something? That was something that even just in our broader Children's Trust work, when we're implementing these evidence-based programs, how can we show that we've made a difference through our interventions? How can we show that we've actually prevented something from happening in the first place? And then asking the question, how do we put these protective factor frameworks into action? It's one thing to know what protective factors should be in place, but it's another to really understand how you build those in families, in individuals, in organizations, and in communities. And so we wanted to answer that question. And I'm kind of hinting at that third question: how do we connect the work at multiple levels? How do we take a look at across the broader society? How do we build up these protective factors? And so that's where the Empower Action model comes in, and it is a public health approach, because the goal is really to meet, to have the maximum benefit for the largest number of people across society. And again, not just keeping those bad things from happening, but also promoting the good things. And so public health really gave us a good lens or a framework for thinking about some additional evidence-based approaches that we could apply to the protective factors. And so I'll spend just a few moments talking about some of the guiding theories, because we know that on the flip side of ACEs, the protective factors are the answer. We know that's the answer to reversing some of the effects of the toxic stress that we know adversity can cause. And so again, our focus was on how we can teach community members to implement these protective factors. And so we wanted to provide some additional frameworks on how those can be used. And so 3 additional frameworks were added on to the protective factors: the socio-ecological model, the life course perspective, and then also race equity and inclusion. And I'll just have a brief overview of each of these. And so we know I'm moving pretty quickly here. We'll have some time for questions in between my portion and Dana's portion, and then also at the end. But we know we want to stop adversity. Ultimately, we'd love to prevent all adversity from happening. We know that bad things will happen, but in an ideal world, we would stop it all from happening in the first place. But that means that we have to have a better understanding of the factors that influence and cause adversity in the first place. And we know people don't just wake up and decide that it's going to be a bad day, that something bad is going to happen to them. So there's a complex interplay happening between individuals, the relationships that they have, that interpersonal level, at the organizational level, and then the community and policy factors that go into how someone interacts with their environment. So we know there's a range of factors or influences that put people at risk for adversity. But on the flip side of that, also a range of influences that can also protect people from experiencing trauma in the first place. And something that I like to point out here is that these rings also overlap, and that suggests that we can have enough impact when we focus on multiple levels at the same time. And that can also help us in sustaining our prevention efforts. And so sort of the key point here is that we knew that the Empower Action would need to be a multi-level approach, that we would need to take a look at impacting adversity at multiple levels across the social ecology. Now, this one may look a little familiar if you've gone through any adverse childhood experiences training. This was the original hypothesis that Drs. Anda and Felitti had in their original ACE study, that it's adverse childhood experiences that leads to disrupted neurodevelopment, which can cause some social, emotional, cognitive impairment, because they were studying the adoption of health risk behaviors. Why do people smoke, or why do people stay in obesity? Because we know that can lead to some really bad diseases and disability, and maybe even an early death. And so we also wanted to take a look at the life course perspective, because we know there's some interventions that we want to focus in early childhood, especially because we know that's such a critical period of development. But this work can be good for all people, and that we also need to think about the adults and the lives of the children that we want to impact here. So thinking about empowering parents, but also people who may plan to be parents, and people that don't plan to be parents, but care about the well-being of their neighbors, friends, and family. And we think that's most people, when they learn about this issue, that they want to get involved. They just may not know exactly how. And so again, adding in this perspective helps us to show them where they fit in across this life course perspective, and also reinforces the idea that it's important for us to collaborate across multiple levels and sectors, not just those who are working with children and families. And then the final component of the model is race, equity, and inclusion. And I almost think at this point, I don't even have to say anything, because we already know that this is such an important part of the conversation, especially today, and continues to increase in importance. We continue to have to raise the flag on this issue and bring it to the forefront of the conversations that we're having, because it continues to play a defining role in one's life trajectory. We know that your zip code can define your health and your outcomes, and that kids of color don't get the same opportunities and resources that many of their white counterparts do. And so if we truly want to make sure that every kid lives their best life, we have to talk about race, and we have to talk about equity. And we have to think about the role that disparities play in this work, and also of those systemic inequities that we want to dismantle through this community process. And so the resource that's highlighted on the screen is from the Annie E. Casey Foundation. They've been a strong partner of ours throughout the years. We've been our South Carolina Kids Count grantee for many years, and we disseminate data on child well-being through that partnership. But they released some tools around a race, equity, and inclusion action guide. And so this is where we pulled out some of our key tenets of race that we wanted to include in our model, and something that we've promoted with the communities that we've served, that Dana will talk about. They created a 7 steps to racial equity. And so that's a tool that we've used in communities, but really just taking a look at how we can apply these race equity tenets across multiple levels of the society and through the protective factors. And so combining each of these theories, we developed the Empower Action Model, which is this pretty colorful model with multiple circles. I'll kind of just walk you through what you're seeing on the screen. So using those current protective factor frameworks, we developed some more action-oriented language, and that's what you'll see in the colorful circle here: the build, grow, support, create, and share, those 5 actionable factors. And then we centered those protective factors around the socio-ecological model. And Dana will talk through how we use that model to talk about how we apply the protective factors across each of those levels. And then surrounding the protective factors are those tenets of race, equity, and inclusion, with the intention that those factors are addressed across the multiple levels, so that we can dismantle that systemic, those systems of racism that are currently in place. And then finally, all of these pieces must be applied across that lifespan. So we know that we have to look at early childhood, but also adulthood, not just focusing on the children, but also adults. So we brought all that together to form the Empower Action model. And so this is just the one part of the model that makes it really unique, is combining these frameworks together. I think this is the first time, or one of the first times, that a group has really pulled those evidence-based frameworks together into one cohesive model. On the next slide, I'm going to share the protective factors in more detail, but the slide after that, I'll show you the second part of the model that really makes it unique, and that's the conditions, and I'll talk a little bit more about that in just a moment. But I'll stop there and see if there's any questions about any of these theories or how we put them together to form the model.
Hi, Mike. My name is Pamela Peterson. I'm Director for Family and Community Engagement for the New Bergen Large City School District. You put up a resource. It said Race, Equity, and Inclusion. Yes. What was the name of the organization again that created that resource?
This is from the Annie E. Casey Foundation. They've done a lot of work around race equity and really have made it even bigger focus of their work in recent past. And so I definitely encourage you, if you haven't seen this resource, it's called the 7 Steps to Advance and Embed Race, Equity, and Inclusion within your organization. So they tried to make it a simple process. We know that it takes some really tough conversations, but really laying out those steps that people can take, because a lot of times that's what they're looking for is, how do I start this journey and where can I expect to go along the way?
Thank you very much.
And someone's posted the link in the chat. So thank you, Julia.
Yeah, Yulika put it in the chat, the link.
Yep. Thank you. All right. I'll keep moving forward here and sharing just what those actionable protective factors are. So they may sound familiar to some of the protective factors that you know from the Center for Social Study, Social Policy, and those other frameworks. But what makes these different is that they include some actionable language. So there's an action word at the beginning of each of these. And so we want to create positive environments for social emotional well-being. We want to support children and families through positive relationships. We want to build resilience through learning skills needed to manage stress and nurture children. We want to share resources that allow individuals and families to meet their basic needs. And finally, we want to grow positive outcomes by promoting individual development. And so these are things that are good for everyone across all ages and stages, and they can be built at all of those levels of impact. And so when we worked with communities, we knew that we wanted to know when we've achieved prevention. When do we know that this protective factor has been implemented or that it's achieved in the community or an organization? And so in order to do that, we needed to share what some of those conditions look like. And I know there's no possible way, even with a magnifying glass, that you could read what's on your screen right now. But I'm going to show an example on the next slide of what one of the protective factors looks like and what those conditions were. And we would be happy to share this graphic if you were interested in taking a look at that. But when working with coalitions, we wanted to take a look at the protective factors, take a look at the conditions, and see what it might take from where we think we currently are to what this condition is describing. And so we know those steps might look differently in each state. We know that something that we create in South Carolina is going to look a lot different for New York or California or wherever that someone may be using this model. Or we also intended that this model could be used on an organizational level. So we know that a big corporation like Google may look different than a nonprofit like Children's Trust. So let me share an example of what this looks like at the individual protective factor level. And so at the top, you'll see those levels of the social ecology, family, the interpersonal and personal levels are sort of combined into a family category here, then organization, community, and public policy. And then you see the protective factor. This one is the share resources. The Center for the Social Study, I always say that their name wrong, it's CSSP. The way their language is concrete supports in times of need. And so ours is share resources that allow individual families to meet their basic needs. At the child level, that would mean that they're able to, well, really, this is more of a child and family level, that they're able to identify and find and receive. So they're able to find the resource they need in their communities, that they have the skills and tools they need to identify and connect supports for their families. On the organizational level, it would look like creating an atmosphere where employees can access resources in times of need and for their own self-care. For a community, that would be having places for people to go to provide that information and connection to services that to the resources that promote resilience. And then on that public policy level, and a lot of times we think about public policy as like state government or federal government, but this could apply to other policymakers as well. It's promoting those policies that create access to resources for all. And so we know oftentimes that public policy can have the most wide sweeping impact on the other levels, but it really takes all of these levels working together to have that protective factor fully implemented. And so Dana is going to show us how the organizations use this model to come up with some action plans based on these conditions. And then the race equity tenets are here, and they're in gray at the bottom of this chart because they should be applied across each of the protective factors. How, so for this protective factor, sharing resources, when people are accessing those resources, you know, are their cultural identities being honored in the resources that they're accessing? Are organizational policies in terms of sharing resources racially and culturally inclusive, and so on and so forth? So taking a look at race equity across each of the levels at each of the protective factors. And so one of the things that we also did was take a look at what existing programs there are for each of the protective factors. I won't get too much into this, but it was very easy for us to take a look at each of the protective factors and think of some statewide nonprofits who were already had a focus on each of these protective factors. And so, you know, Harvest Hope is a national organization that you may be familiar with providing those food resources. YMCA, making that connection to resources, and family resource centers, providing those concrete supports in times of need. And we did that for each of these. And it's something that we share with organizations so that they can see how these protective factors are already at work, and then also kind of get an idea of where some of the gaps may be. And so as we were having those conversations, we also took a look at a three-step process, a tool that we created along with the Empower Action model called the Ready, Set, Go Guide. And so this was going to be our resource for especially community members or organizations who wanted to implement this model to know what to do, to know how to do it. And so this guide includes several different key elements that Dana will kind of talk through the process, but we took a look at community level data profiles. We also knew that it was going to be important to seek parent and community input. And we also created some checklists for each of those protective factors across the socio-ecological levels, some planning questions for groups to go through when they were taking a look at the data and considering the different levels. We also layered in some information about collective impact, since this work was happening in coalitions, establishing those group timelines, making sure everyone was at the table, that Dana will talk a lot more about, and then also some tools for monitoring of progress. So we also had an evaluation plan that was created alongside some of these tools. And so the Ready, Set, Go guide outlines a 3-step process. And this process is what I referenced at the very beginning when I was talking about that prevention framework. This is one of the key findings of some of their work, is really going through this process of deciding on the journey that you want to take before you jump into planning for action. And then once you have that plan for action, going into working your plan and monitoring your progress and making tweaks along the way. So I won't get too much into this because Dana's going to spend a lot of time talking through this Ready, Set, Go process. But it all came with that theme of the road, and we're going on a journey together, and really spent a lot of time in the readiness phase, because this was a lot of new information for a lot of the communities that we were working with. And so introducing them to ACEs, introducing them to protective factors, and then adding in this Empower Action component of how we can plan around preventing ACEs and promoting protective factors. And with the groups that we worked with, we also created an action plan for them to keep track of the work they had accomplished throughout the way. And that's what Dana is now going to spend some time talking through, how they were able to fill in that plan along the way, and share some examples of what they came up with using the Empower Action model.
Great, thank you, Michael.
No problem.
Let me pull my screen up here now. Okay, so I get to talk to you guys about what the Empower Action model looks like in the field itself, which is a lot of fun to be able to do. And I actually I don't normally follow a script, but I have a script I'm going to follow for this because there's a lot of information that I want to get through in a short period of time. I want to make sure I get everything covered. So as Michael mentioned, I'm the training coordinator, but I was also one of the coaches on this pilot project. Michael was a coach for Resilient Richland, and I was the coach for Empower Oconee, and we had one other coworker who served as the coach for Empower Action Marlboro. We chose to pilot use of the model in these 3 counties that you see here. The counties were selected based on high ACE scores and high child maltreatment cases, the capacity or their readiness to tackle this work, and because the counties represented different demographics. While it would be a stretch to call our state capital in Richland County a metropolitan area, especially for those of you from New York, it is more urban and has a greater number of resources than Marlboro and Oconee counties, which are in more rural parts of the state. I served as the coach for Oconee County. And I want you to notice here at the bottom left corner in each of these slides, I have labeled as part of Ready, Set, Go, as you saw in the planning guide that Michael just showed you. Think of Ready, Set, Go as a PDSA cycle, if you're familiar with that. The idea of plan, do, study, act. So ready is part of the planning, set is really getting ready to do, and then go is studying and acting and moving the work along. We began work using the model with community-based child abuse prevention funds, CBCAP funds, in the fall of 2018. We started off with 2 key objectives: for county coalitions to have an infrastructure in place to support the creation of a sustainable long-range plan informed by parents and caregivers to address the prevention of child maltreatment and promotion of child well-being. The second objectives was that coalitions would actually have a sustainable long-range plan. So objective 1 was just to create the infrastructure to develop the plan, and objective 2 was to develop the plan itself. We originally anticipated that this process, objectives 1 and 2, would take a year. It actually ended up taking a little more than 2 years. Michael also mentioned that we used the collective impact process. So the term backbone organization comes from collective impact, and I'll talk about the components of collective impact here in just a minute. But using the collective impact approach, this is the infrastructure we used for the work. I mentioned that building the infrastructure was one of the 2 objectives, but that took a lot more work than just what you see here on paper. A backbone organization identified by us at Children's Trust serves as the fiscal agent and has a staff person who coordinates the project. The backbone agency brought together key stakeholders, and for key stakeholders, I think that that's a term that we use to mean lots of different things. But for us, key stakeholders included anyone who could help develop the plan, anyone who could help implement the plan, and anyone who could benefit from the plan. That was a big piece, is having those who are the end users of the plan involved in the planning itself. And we wanted to make sure that that group was representative of each level of the socio-ecology to form our core team. The core team plans agendas, facilitates meetings, and provides continuous communication to the county coalition. The Children's Trust coach works closely with the backbone organization and the core team, serving as a guide from the side rather than a sage from the stage. We wanted this work to be as community-driven as possible, with us serving as support only. The core team received lots of training, and you're going to hear me mention that again, on topics like collective impact, the Empower Action model itself, race equity and inclusion, adverse childhood experiences, and protective factors. They then identified and invited specific community members to serve on the coalition, again, representative of the socio-ecological model levels. Core teams have on average 6 to 10 members. Coalitions vary in size, but there tend to be somewhere between 10 and 15 who are actively involved and attend every meeting. In terms of collective impact, just in case you aren't familiar with that, there are 5 core components to collective impact. 1 is the common agenda, so everyone is on the same page working towards the same goal. 2 is shared measurement. So everyone's looking at the same data sources and looking to pull their information in the same ways. The 3rd is that there be mutually reinforcing activities. There's not duplication of services, but what one group does here can help to support or complement what another group over here is doing. Building trust and continuous communication is huge, and I'm going to hit on that again here in just a minute. And then having a coordinator or backbone support infrastructure is critical, because we needed to have a dedicated coordinator separate from participating organizations or underlying programs that can plan, manage, and handle all of the logistics in practical ways. All right, this is my favorite part. This is the piece where I feel like I could sit forever. I talk about this in every training I do. We're talking about the importance of relationships in strengthening children and families, and also in building community-wide work. For the structure that we developed to work, a great deal of time was spent building relationships. The coach spent time with the backbone organization staff, then with the core team. We spent more than 6 months just developing relationships with core team members, and those were groups of around 6 to 10 people. because we wanted there to be a high level of trust and comfort with one another. We delivered numerous trainings during that time to the core team to allow that group to learn together. We know that in the nonprofit world in particular, though I think this is the world at large, we can get so focused on grant deliverables that we easily skip the initial investment of time that's needed to truly build relationships. We move straight to outcomes. But the outcomes will be more equitable, more inclusive, and better tailored to the specific and unique needs of the community if we have built relationships. We need to develop trust, understand our assets and our opportunities, and tackle challenging topics. We also have to make sure that those who will most be served by the plan are equally involved in developing the plan. That takes building a lot of trust too. Michael talked briefly about the action plan template we provided to our coalitions. I'm going to walk you through the three components of that as I talk about the process counties went through to develop their plan. Because part one is actually the executive summary of the work, I'm going to start us out looking at part two. This section involved a great deal of training. Have I mentioned that there was a lot of training involved? So here you see that once the core team and the coalition were formed, we began pulling data and gathering data, including county-specific information on adverse childhood experiences, which we were fortunate to have, child maltreatment data, and child well-being. So those were data sources that already existed. We then collected community asset surveys that were developed by Children's Trust. They're in our toolkit with the Empower Action model. Those tools measured knowledge and utilization of community, child, and family resources and beliefs about the presence of protective factors in neighborhoods across the county. Core team and coalition capacity assessments, also developed by Children's Trust, helped us identify gaps in knowledge and skills, while collaboration assessments kept us tuned into how well the groups were functioning, a critical tool for measuring power dynamics, equity, and inclusion. So this was a neat project for me to work on because I'd worked on some previous community engagement projects where we didn't have the opportunity to really assess the level of collaboration that the planning team had. We were measuring community outcomes as a whole, and we had the opportunity with this to really dive into how well core team and coalition members were working together, how much they felt they knew and understood the information we were talking about, and how equipped they felt they were to share this information out in the community. After looking at all the data, trends began to emerge, and coalitions were able to identify 3 priority areas. That was our ask of them, to identify three priority areas that they wanted their plan to address. Looking at the data made a huge difference with priority area selection. The county that I coached went into this process already planning to tackle transportation as a big issue for residents. But when we did the community asset survey, what they found out is that the community members at large weren't very concerned about transportation, that there were other issues that were much more important to them. So this section of the action plan is the meat. Using the protective factors as the guide for tackling the identified priorities, members use the Empower Action grid. And Michael showed this to you, but in case you don't remember, this huge grid, which we lovingly refer to as the grid. This was used to crosswalk protective factors with each level of the socio-ecological model. So what you see here is actually a partial sample of a completed action plan using the protective factor of building resilience. I wanted you to see how all of the pieces of the model that Michael showed you in our beautiful circle, how all of these pieces came together. So what you see at the top here is one of the protective factors to build resilience through learning skills needed to manage stress and nurture relationships. And then below, what you see is each level of the socioecology. And the language here shows what steps a county plans to take addressing their priority areas to build resilience. One county had identified safe and affordable housing as a priority. I love this. They identified safe and affordable housing as a priority, but in the process of doing this part of the action plan, they recognized that public policy work was going to take them a very long time to really make change happen with safe and affordable housing. So they actually decided we want to do something that's going to have a bigger difference now. So they changed their priority from safe and affordable housing to strong communities and chose instead to establish new safe places for kids to play and families to gather, connecting neighbors with one another, and working with landlords and public housing to make updates to property both externally and internally so that residents could be proud of where they lived. So actually developing neighborhoods where people felt safer without having to go all the way through the policy level to build new homes and make homes more safe and affordable. And I know here you're not going to be able to read all of the little pieces at the bottom, and that's fine. We're going to leave a little bit of time for you to ask questions about any of those things if you'd like to. But I want to give you another sample of a page from an action plan. This is growing positive outcomes by promoting individual development. So with that protective factor, one county chose to support new Strengthening Families programs. SFP teaches parents of kids ages 6 to 12 parenting and refusal skills and teaches the kids themselves life skills. Because parents and children attend the program together, there is opportunity for them to learn together and it strengthens the relationship. So there was part in the family section here that they could mention specifically related to the children and parents that would attend those sessions. Now, I will say that this part of the action plan, where protective factors and socio-ecological model really come together, felt very daunting for sites. And this was a pilot, so this was the first time that we had put all of this together for people to use. It took a while for all of these pieces to click for them. This is where they saw how all the training they'd received and all the prep work they had done came together. And we actually had, I remember after we'd spent more than a year working on all of this and training on each of the pieces. It was in doing this action plan that one of our sites finally said, now I get it. Now it all makes sense, because they were able to see how all of these things connected to strengthen their community. And they realized too that each piece of the Empower Action model is very intentional and makes an important distinction in developing the plan when you're looking at this across the levels of the socio-ecology and not just focusing on protective factors. All right, then we have the executive summary. This is first in the plan. So if you had a copy of the plan in front of you, this would be the first page that you would see. It highlights all the parts of the action plan development. And we envision this being a tool that counties could use to share with legislators, to share with other potential funders, any media outlets or other key stakeholders, to let them know in a bite-sized chunk, this is what we've done, this is how we did it, and this is what we expect to do next. This is the executive summary, where they actually wrote down how they developed the plan. And this was, uniquely enough, this was done at the end. So it was kind of for them a review of all of the steps that it took for them to get to this place. It reminded them of all the hard work that they had done and reminded them of each piece that went into the development along the way. It also served as a checkpoint for them to make sure that they'd spent enough time considering race, equity, and inclusion, engaging parents and families, and applying the data throughout the plan. If there were any piece of this executive summary page that did not speak to race, equity, and inclusion, even though it doesn't specifically mention those words, groups ran through this with a race equity lens again at the end to make sure that everything that they were doing was going to best meet the needs of all members of their community. This part was fun, the who was involved, because after 2.5 years of work on this, you kind of forget all of the people that you engaged along the way. So with this, they had the opportunity to list the names of every organization that they worked with. It served as a way for them to identify possibly any key partners that they meant to pull in at some point, but forgot to pull in. This particular county, when they were going through and completing this part of the action plan, realized that they had engaged the Department of Juvenile Justice, but had failed to engage their sheriff's office or their local law enforcement. So that's something that they went back and did as they began plan implementation, because they knew they really wanted those folks at the table and involved in these conversations. The what's next part, this is actually the highlight of the plan itself, what's going to happen and what those priority areas are. So you see 1, 2, and 3 here. This is the 3 priority areas that were identified after reviewing all of the data up front. So this particular community selected strong communities instead of safe and affordable housing. They selected strong communities. They also identified early childhood as a critical time period that they wanted to work on, and youth support. They found from all of their data collection, the community asset surveys, that there were a lot of things available across the community for early childhood, for kids in preschool, kindergarten, elementary school, but there wasn't a whole lot for young people. They felt that that was something that was really missing. So that's an area that they chose to focus on here. All of their action plans, so they began work on this in 2018. All of their action plans were submitted for us to approve by December of 2020. All of their plans, there were some revisions that were made to the plan after we reviewed it and kind of compared it again to the original, the Empower Action model and the intent of the model. All of their plans were reviewed. Some small changes were suggested before they began implementation of the plan. And then we encourage them now, as they are in the implementation phase, for them to consistently go back and revisit this model. We know that their plan is going to grow and change over time. There are some areas that maybe they'll be able to tackle. One of the priority areas related to early childhood that one of our coalitions selected was to improve playgrounds in the community so that they were safer places for young children to play and for parents to take their young children. So that was a task that's kind of done and over with and won't have to be revisited until maybe 10 15 years down the road when work needs to be done in that playground. But there are some other areas like mentoring programs that got started that are going to take consistent investment of time. So we worked with these groups on some sustainability and are continuing to have those conversations, but encouraging them to always be looking at how they can continue to promote these protective factors in the work that they're doing using a race equity lens. So that was sort of crash course in 3 years of work. There's a lot of work that went into this. It's amazing that we can talk about it in less than an hour. But I'd love to see if you have any questions that Michael or I, either one, can answer for you. Michael and I both served as coaches for 2 different communities.
So just to say that I don't see any questions in the chat, but of course, if anyone would like to unmute themselves, I do have a question maybe to jumpstart us.
Great.
You mentioned that you collected data to assess and measure and all that, and I'm curious if you can share just a snippet about that, because I think that's one of the sticky points oftentimes. Measuring what we're doing and how we're doing it.
Yes. Well, so, I mentioned I've worked on some federal projects before where we didn't have the freedom to be able to do that. So it was nice to be able to do that here. And a lot of the team assessments, so the core team and the coalition assessments that we did were primarily for our use here at Children's Trust, because we wanted to know as the coaches, what continued resources do they need, or what's some direction that we can provide for them that seems to be missing for them right now. So we used those, we shared that data back out with them so they knew what the results of that data were. But we use that in many ways to drive our work with them. And then the community asset survey that was conducted in each county was a great way for us to measure how whether people are familiar with resources that are there, whether they've used resources that are there, and what their thoughts are on living in the community in general. There are some questions like, have you ever experienced racism? That was the question. And just some other really fascinating questions like that, and to be able to get community members who can say, yes, I feel safe in my neighborhood. Yes, I have someone I can call if I need help with my children in my neighborhood. All of that information was amazing. And it would have been nice to be able to go back. It would be nice 10 years from now to be able to go back and do that survey again to see if there's been a change in that information. Unfortunately, because of the length of time we had on this grant, we're not able to go back and capture and see how much change happened because of this work. But we have data collection tools that they're licensed as part of the Empower Action model, but we are able to share those with folks who have the license. I see something in the chat. Is that another question? Oh, no.
Yeah, that
So
would
I
be
have a
wonderful.
question for you, Dana.
Okay.
I'm interested in how much time you were able to spend at the very end after you were implementing some of this work in the communities to really have actually the coalitions really evaluate their work. Did you have them take a look at what they were able to accomplish?
Yes. And honestly, that's still some conversation, because implementation of a plan like this it's not so ready, set, go, because there are things that it takes time to build up. There are some things that you can go in and write a check to start a program. And there are other things that are going to take some time for them to get up and running. So have had some conversations with them about how they will measure their success moving forward. But one of the things that's been both a plus and a minus about the way we've set this plan up is we did all of this coaching on the front end, and now we have blessed them and said, go forth and do great things. But they're kind of on their own now in terms of how they want to measure their success moving forward. Are there any other questions? I see we stayed right on time.
I have a quick question.
Okay.
That I'm struggling with in my community.
Okay.
With the polarization, I should say, in our country over the years in which you conducted this, did you experience pushback from factions who oppose things like DEI work? And, you know, and if you did, how did you, do you have any strategies that you use to manage that and to build those relationships in order to train, educate, heal, and bring the community together?
Yes. So I can give you one specific example. We had a county that wanted to bring in a DEI speaker to do some training with them as a coalition, but to then also open that up to the community. And because of the organization that served as the backbone, that organization was getting a lot of heat about that. And I don't, Michael, you may not have even known that that happened, because that happened in my county. So they had to separate out and remove the training from the backbone organization so that it was clear that it was a community-led thing and not a single agency hosting this, if that makes sense. It was just sort of navigating how that was presented to people. But that was the only thing that I had come up in my community. For us, when it came to conversations about race, equity, and inclusion, yes, there was a training that they wanted to hold. But in general, in all of the conversations, we were saying, okay, we're talking about delivering a program for kids ages 6 to 11. How do we make sure that all kids across our community have access to this program? Whether it's Hispanic kids, Black kids, or white kids, how do we make sure everyone has equal access to this program and that it's going to meet their needs? That just became how we talked about things. So it didn't have to be its own entity. We didn't have an office of race, equity, and inclusion that was handling this. It just became part of conversation. And there was enough comfort built from building those relationships that we could say to one another, I think you're leaving somebody out in this conversation right now. Let's make sure we're also talking about this part of our community. So yeah, that's probably not as clear-cut an answer as you might have wanted.
No, it's actually, I want to say thank you. It was a wonderful answer. And I think that it's in line with what we're trying to practice, which is that, you know, using the language the correct way and avoiding the buzzwords that have become politicized is an important part of this. But yeah, thank you so much. I greatly appreciate your addressing that.
You're welcome. And I try always to, I still use race, equity, and inclusion because those are important terms. But I always say, are we meeting the unique needs of every member of our community? Because that covers a whole lot of different areas for children with disabilities, for children with any kind of special needs, for children who come from different backgrounds, live in different parts of our community, have different socioeconomic status. All of that, are we meeting the unique needs of every child in our community? All right, I see it looks like Sonia has a hand up.
Yes, hi, how are you? Thank you for the wonderful presentation. And I have a question regarding the skills taught to individuals and families. Did they include any training in self-regulation skills or tools for parents to learn how to self-regulate, and even for families to do these things together? And I specifically want to mention a program that is being offered through the Westchester Library System, and it's called Breath, Body, Mind. And through movement and breathing and mindfulness, they teach people specific and practical and easy to learn tools to regulate their nervous system.
Thank you for sharing that. And I will say that is part of the protective factor related both to grow and to understand, getting to the area of social emotional development. So that's part of what we're asking them to consider. That's not necessarily something that they drew out as part of their 3 main priorities for now, but that doesn't mean that's not something that they won't be visiting as they go forward. And they also tried as much as possible to partner with organizations that were already doing great things instead of just creating a lot of new things themselves. And there's a lot of great work going on in South Carolina schools right now around social emotional learning that they've been able to jump on board with. Let's stop sharing my screen.
Well, I want to thank Michael and Dana for a wonderful presentation today. You know, it really is great to see another state that's doing wonderful work. We're just so happy that, you know, it's just wonderful to see that other states and other people are interested in the same things we are in New York State. So thank you so very much.
You are welcome.
Thank you for having us.
And I know that we're kind of over our time. So again, we hope everybody enjoys this wonderful weather that we're having. Have a beautiful day, get outside. And certainly for all of us, being our last kind of webinar or Zoom training in the series, we encourage everyone to focus on building resilient communities, right? It's so important. It's important work wherever we live, whether it's in South Carolina or in New York State or in other parts of our country. So stay tuned. We hope you will join us this summer. We'll be in touch with you and let you know the dates and time, and we'll continue this work together. And again, thank you, Michael and Dana, for being with us and our team that's helped put this program together. Have a wonderful day.